Hey guys, hope you all are doing good and today we are going to discuss about schizophrenia or schizophrenia. So either you can pronounce it as schizophrenia or schizophrenia. Schizophrenia or schizophrenia. I will tell schizophrenia. Schizophrenia is a chronic and a severe mental health disorder and it's affecting around 20 million people worldwide according to World Health Organization report. Whenever we study something related to psychiatry or mental health disorder, first we will listen about schizophrenia or schizophrenia. So in this video we are going to discuss what is schizophrenia, what is the cause of schizophrenia, or what is the etiological factor behind schizophrenia, or is there any etiological factor behind the schizophrenia, and what are all the type of schizophrenia, how we can manage schizophrenia, is it curable or not, and what are all the nursing management of schizophrenia. That things we are going to discuss in this video. First, a definition we will see. What is schizophrenia? Schizophrenia is a condition characterized by disturbances in thinking, attitude, and behavior. I will call it as TAB: thinking, attitude, behavior. T from thinking, A from attitude, and B from behavior. So, schizophrenia is a condition characterized by TAB: thinking, attitude, and behavior. So, if you have schizophrenia, you will get problems in your thinking, you will get problems in your attitude, and you will get problems in your behavior. This means the person may not always distinguish their thoughts and ideas from reality. They couldn't or they can't understand or see what is real and what their thoughts. It will get disconnect from the reality. Now we will see some facts about schizophrenia. Schizophrenia affects 1 in 100 people. 1 in 100 people. Of course, that's not a bad range. 1 in 100 people. There are different types of or different kinds of schizophrenia. There are different causes and exact causes unknown for schizophrenia. So there are a lot of risk factors we can see which precipitate schizophrenia, but the exact cause of this condition is unknown. Schizophrenia is a common psychiatric disorder. So there are a lot of myths about schizophrenia. This is a dangerous psychiatric condition and this is very uncommon. Like that, lot of myths are there, but actually schizophrenia is a common psychiatric disorder. Well, coming to the etiology or etiological factor, the exact cause of schizophrenia is unknown. We don't know what is the exact cause behind this schizophrenia. Still, there are lot of researches are happening to find out the exact cause of schizophrenia, but still we don't know what is the exact cause. But there are lot of risk factors and causes we can see which precipitate this condition. Now we are going to see the risk factors which create or which develop, which lead to schizophrenia. First thing is genetics or genetical factors, or we can say genes. Genes, through the genes or from generation to generation, we can say the generation to generation it will get spread. But we can't say that a specific gene is responsible for schizophrenia. It was spread from generation to generation through genes, but we can't say that a specific gene is responsible for schizophrenia. That's what I've told you. The exact cause is unknown. If you can say this is a specific gene, this is responsible for schizophrenia, means no need of studying these risk factors. We can say that is the exact etiology. So specifically, I am telling that we can't say a specific gene is responsible for schizophrenia, but genetics factors are playing a major role in development of schizophrenia in people. So it was spread from generation to generation. That means your family members or your grandparents is having the problem, means there are chances of spreading the condition from that generation to your generation. Next thing, different very severe stressful life events are reasons for this schizophrenia. It's very stressful. not a simple stress. Okay, all we have financial problems, family struggles, and different social problems, struggles, dilemmas in life, etc. But very severe stress problems means that may leads to schizophrenia. Very severe stressful life events like abuse, rapes, financial struggles like very severe financial struggles, family struggles, etc. Simple stress and all will not lead to this condition. Very severe or very severe and beyond the limits. The stress is beyond the limits means that may lead to schizophrenia. Next thing is excessive use of different recreational drugs. Recreational drugs in Western countries or in Asian countries, wherever, irrespective of countries, if you see to the crowd, many people are using different kinds of recreational drugs. But excessive use of different kinds of recreational drugs may lead to many psychiatric problems, many physiological problems. Among that problem, schizophrenia is also one problem. Then abnormal dopamine and serotonin level, or we can simply say abnormal hormone level, is also a reason behind schizophrenia. Another two factors are improper brain development and birth complications. Improper brain development. Brain need to develop in the proper way. There are proper milestones are there for brain development also. If it's properly developing, there won't be chance of different kinds of mental and physical problem. Sometimes improper brain development may lead to specifically and clearly I mentioned that sometime improper brain development may lead to schizophrenia. But all the people with improper brain development will not show the symptoms of schizophrenia. The other thing is birth complications. Birth complications also sometimes may lead to schizophrenia. So these are all the risk factors which precipitate schizophrenia. Genetics, genes from one generation to another generation. Stressful life events, very severe stressful life events. Recreational drugs, excessive use of recreational drugs. Abnormal hormone level. Improper brain development and birth complications are some of the risk factors behind schizophrenia, but the exact etiology behind this condition or exact etiology of this condition is unknown. So, symptoms. Symptoms include positive symptoms and negative symptoms. Positive symptoms include hallucination, delusion, etc. Hallucination means feeling of some experiences that are not real and others cannot experience that one. Example like schizophrenic patient can hear some unusual sound, but the person who is standing or sitting near to the person can't listen the particular sound. The patient will tell some music is coming, can you hear, is it audible? But others will tell we can't hear. But the particular patient can listen that is auditory hallucination. Next thing is visual hallucination. So but patients can see something is there in front of them, some shadows they will see, some person is standing in front of them, like that they will tell. But we can't see that. We, in the sense, the person without schizophrenia, mentally healthy person cannot see that. Tactile hallucination, like touching, something is touching, someone is touching, like that they will get the feeling, but others don't get the feeling. Gustatory hallucination and olfactory hallucination. So some bitter taste, if same food me and a patient is eating, means the patient will tell I'm getting some different taste, lead taste, iron taste, some bitter taste, salt taste, but I don't feel that taste. Olfactory hallucination, smell, some unusual smell they will get, but we don't feel that smell if we are standing or sitting or walking along with them. So this is known as hallucination. Sometimes this thing will disturb their normal daily living activities, and that may leads to lot of emotional imbalance and disturbances to their life. So hallucination means feeling of some experiences that are not real and others cannot experience that one. Next positive symptom is delusion. Delusion means disorganized thinking. We have a pattern of thinking. We will perceive in a pattern, we will think in a pattern. But in the case of schizophrenic patient, they will show a disorganized thinking pattern. Examples of delusions are delusions of persecution. Delusion of persecution means bizarre ideas. Bizarre ideas. I will give you an example, then you will easily understand what is delusion of persecution or bizarre idea. People means others are trying to poison them with radioactive particles through my tap water or food, like that they will complain. If someone is giving some food to them, means don't eat that, I'll not eat that, like that they will tell to the nurse or to the healthcare professional, and they will tell that they are trying to kill me by adding some particles, some poison in that. That kind of bizarre ideas they have. They will always tell, if we give food or some water or something to them, they will tell they are trying to kill me, they are adding some radioactive substances or poison through the tap water to kill me. So bizarre ideas they have. They will persecute some ideas in their mind, and they will tell that things to others, and that will give an imbalance to their life. That is delusion of persecution. Next thing is delusion of reference. Delusion of reference means patient will think that they are very special people. They are very, very special people. Like some ad is coming into the in TV, and all are watching, means they will tell that particular person is looking into me, looking at me, and the particular ad is for me. They are conveying some messages to me. That's not for you. That's not for others. So they will think that they are very, very special. So they have some reference. That feeling is known as delusion of reference. Next is delusion of grandiosity. Delusion of grandiosity means the patient will think that they are very famous. They are very, very important figures like Jesus Christ, Prime Minister, President, chief guest, like that. They have a feeling always. So someone is standing near to them, they'll tell, I am very big person, I am very famous person, and if you need some help, I can help you. I have the meeting with this person after this conversation, after this meeting. So if you need something, you just tell me, I can get it done. If you need blessing, I can bless you. Like they will think that they are very famous. So that is known as delusion of grandiosity. Next is delusion of control. Delusion of control means the patients feel that the patient's thoughts are controlled by other people, so they don't tell anything to others, because they'll think that they feel that their thoughts are controlled by others. They don't have any control over their thoughts. So if they are trying to tell something to others, they will tell it's not my thing, someone is controlling. Some chip is there in my head, some chip is there in my heart or in my hand, and someone is controlling. This is not me, I'm not talking this, someone is controlling. That kind of feeling, that kind of activities the patient will show. So these are all the examples for delusion. And delusion or type of delusion, and delusions are very common. Either any kind of delusion or 2 to 3 type of delusions we can see in schizophrenic patients. So delusion is also a positive symptom of schizophrenia. Next thing is negative symptoms. Negative symptoms include lack of motivation. They don't get any motivation to do anything. They'll be like stones. Sometimes they'll be in a mute stage. Very slow body movement they will show. Very slow body movement. They don't show normal body movements. Disturbed sleep. They sometimes they'll show oversleep. Sometimes they will have disturbed sleep. Poor personal hygiene. They will not maintain any personal hygiene. They don't talk much. Changes in the body language. Lack of eye contact. They cannot maintain eye contact. When we talk to the schizophrenic patient, they look down. They bend their head and talk. Reduced range of emotions. Less interest in socializing or hobbies in any activities. And low sex drive. So these are all the negative symptoms. While coming to the types, according to ICD classification, that means International Classification of Disorder, there are 8 types of schizophrenia. They are paranoid schizophrenia, hebephrenic schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, residual schizophrenia, symbol schizophrenia, CENESTHOPATHIC schizophrenia, and unspecified schizophrenia. Among these types, paranoid schizophrenia is one of the most prevailing type or common type of schizophrenia. What is paranoid schizophrenia? Paranoid schizophrenia is the common form of schizophrenia and it is characterized by positive symptoms. That means hallucination and delusions. They will show different type of hallucination like auditory hallucination, visual hallucination, sometimes delusion of persecution, delusion of grandiosity. And it develops in later age of life. That means after 40 years of old. Then there won't be no speech and emotions problem. This paranoid schizophrenic patient will not show any kind of speech and emotional problems. So we will feel that the patient is very normal while talking to them. Next one is hebephrenic schizophrenia. Hebephrenic schizophrenia is characterized by short-lasting delusions and hallucinations. So positive symptoms we can see in hebephrenic schizophrenia. It develops in the age group between 25 and 15 or 15 and 25 years of old. That means adulthood and early adolescent and adulthood period, this schizophrenia will develop. Apart from the positive symptoms, we can see negative symptoms also in hebephrenic schizophrenia, such as disorganized thoughts, disorganized behavior, disorganized speech, no emotions in face, emotional imbalance. For example, laugh at the place where need to be sad. Crying in the place where we need to enjoy. So emotional imbalance they will show. Next type is catatonic schizophrenia. Catatonic schizophrenia is one of the rarest type of schizophrenia and it is characterized by unusual, limited and sudden movement. That points are important. Unusual, limited and sudden movements. They don't talk much. They are in a mute stage. They mimic other speech and movement. They'll mimic other speech. If I talk something, the same thing they'll repeat. But suddenly they'll reply back. We can't imagine this much fast they can reply back, and at the same time they will maintain a mute stage. Next thing is stuporous activity. That means less talk and no response. When we talk something to that schizophrenic patient, they don't give much response back. They don't talk much. They don't give proper reply back. They'll be in mute stage and they'll be in stuporous stage. That is catatonic schizophrenia. Next one is undifferentiated schizophrenia. From the word itself, you can understand the meaning undifferentiated. It is characterized by mixed signs of paranoid schizophrenia, hebephrenic schizophrenia, and catatonic schizophrenia. Sometimes the patient will show paranoid schizophrenic symptoms like positive symptoms or delusion of grandiosity or hallucination, auditory hallucination. Sometimes the patient will show hebephrenic schizophrenic symptoms. Sometimes the patient will show the rarest catatonic schizophrenic symptom, but doesn't exactly fit into one of these types alone. So that's why we are calling it as undifferentiated schizophrenia. We cannot differentiate which kind of schizophrenia. For 1 or 6 months or 2 weeks, they will show paranoid schizophrenic symptoms. After that, suddenly they will change into hebephrenic schizophrenic condition. Then again, they will go to paranoid, then they'll come to catatonic symptoms. That means they don't fit into one of this type alone. So we are calling it as undifferentiated schizophrenia. Next one is residual schizophrenia. Residual schizophrenia is characterized by negative symptoms of schizophrenia, and we can't see any positive symptoms like delusion of grandiosity or hallucination or auditory hallucination. That kind of characteristic features or symptoms we can't see in residual schizophrenia. It is mainly characterized by negative symptoms of schizophrenia such as slow movement, poor memory, lack of concentration, and poor personal hygiene. Slow movement, poor memory, lack of concentration, and poor personal hygiene. Next thing is symbol schizophrenia. In symbol schizophrenia, negative symptoms are prominent. In paranoid schizophrenia, I told you positive symptoms are prominent. Same way, in symbol schizophrenia, negative symptoms are prominent. Positive symptoms are very rare in symbol schizophrenia. Sometime we will see one or two positive symptoms we can see, but negative symptoms are prominent here. Negative symptoms include slow movement, memory loss, lack of concentration, poor personal hygiene, etc. First, the symptoms will be in a very less severe stage, and gradually the symptoms will get worse. First, in the first stage of simple schizophrenia, the symptoms will be in first degree. We don't feel that much complication, but gradually day by day, the symptoms will get worse. That is the speciality of simple schizophrenia. First, we will feel it is very simple, but gradually it will get complicated. And one thing you have to understand, that you just keep it in your mind, that negative symptoms are prominent in simple schizophrenia. Next thing is CENESTHOPATHIC schizophrenia. CENESTHOPATHIC schizophrenia is characterized by experience of unusual bodily sensation. Along with paranoid schizophrenia, we can see this CENESTHOPATHIC schizophrenia, and it is characterized by experience of unusual bodily sensations. And last one is unspecified schizophrenia. Unspecified schizophrenia means all type of schizophrenia symptoms will arise in the patient. What are all the things I have discussed right now? Like 8 type I have discussed with you right now. All type schizophrenia symptoms will see in the patient, but clearly doesn't fit into any types. That is a specialty of unspecified. We can specify what type of schizophrenia. That is known as unspecified schizophrenia. So these are all the 8 type of schizophrenia according to ICD classification or international classification of disorder. Next, while coming to the diagnosis, how we can diagnose this condition? We can diagnose this condition with the help of history collection, with the help of physical examination, with the help of mental status examination, with the help of neurological examination, with the help of psychiatric evaluation, with the help of different kinds of test and screening. So, general physical examination or general diagnostic procedures only we can use to find out this condition. A proper mental status examination is playing a major role in diagnosis of schizophrenia. Then other symptoms of schizophrenia, apart from these positive symptoms, negative symptoms, we can see some other symptoms also in the patient, such as cognitive impairment. They will show thinking problem, cognition. They can't do the cognitive process in proper way. So cognitive impairment they will show, unable to sustain attention. That means it's a part of cognitive impairment only. It is a type of cognitive problem only, instability in attention. Then they will show memory problems. That is also a cognitive process problem only. Then poor decision making. They can't take a decision in proper way because they have cognitive impairment. They have problems in attention. Of course, they have problems in memory, and that may lead to poor decision making capacity. Next, we will see some myths about schizophrenia. There are some myths about schizophrenia, like schizophrenia is a split personality disorder. That is entirely wrong, because split personality disorder is other disorder. In split personality, if you study the symptoms, that's entirely different from schizophrenia. It is a rare condition. No, this is the common condition. If you look into the psychiatric disorders history, we can understand that schizophrenia is one of the commonest psychiatric disorder. Then schizophrenic patients are dangerous. Not at all. All mental health disorders will go to a dangerous level if the patient is beyond emotional control. At the same time, the patient will behave in a normal way also. So don't think that schizophrenia patients are dangerous patients. Then patient with schizophrenia can't help it. No, we can't cure this condition, but we can control the symptoms. We can control the symptoms. Next, now we will see the warning signs of schizophrenia. Some warning signs before the occurrence of schizophrenia or before developing schizophrenia, we can see some clear warning signs in the patients. They are depression, social withdrawal, suspiciousness. They will show a suspicious nature in everything. Extreme reaction to criticism. Someone is criticizing, or someone is telling you you are doing in a wrong way. Suddenly they'll get angry. Extreme reaction to criticism. lack of personal hygiene, expressionless gaze, inability to cry or express joy, emotionless face they will show, insomnia they will show, or oversleep they will show, unable to concentrate, strained use of words or way of speaking, or we can say disorganized speech. These are some warning signs of schizophrenia. Next, disorganized speech means in disorganized speech we can see some specific thing like loose association. Loose association means rapidly or suddenly shifting topics to topic with no connection between the topics. If I'm talking about schizophrenia, I should complete schizophrenia first, then I can go to other topic, right? But when I'm talking schizophrenia, one word I'm talking about schizophrenia, in the next moment I'm talking about myocardial infarction means you can imagine the situation. So rapidly shifting from topic to topic means that is known as loose association. That is an example or that is a type of disorganized speech. The neologism. Neo means what? New. Neologism means made up new words or phrases with no meaning. You only can understand the meaning of the words what you're saying, made up of new words or phrases. Then perseveration. Perseveration means repetition of words and statements. If I'm telling something, I'm telling something and keep on repeating for 1 hour means that is known as perseveration. Clang. Clang means meaningless use of words like rhymes. I will tell you an example like I said the bread and the spread and the shed and the head, like continuously meaningless use or repetition of words in a rhythmic way like a rhymes means that is known as clangs. These are all the things we can see under disorganized speech. So schizophrenic patient will definitely show one of this disorganized speech type, loose association. Sometimes if you talk to a schizophrenic patient, definitely they will show either loose association or neologism or perseveration or clang or meaningless use of words. Then, while coming to the treatment, unfortunately, there is no cure for schizophrenia, but we can control the symptom. There is no cure for schizophrenia, but definitely we can control the symptoms by giving medications and by giving different kinds of therapies. So therapies are playing a major role in the treatment of schizophrenia. The treatment result shows that 3 in 10 people may have lasting recovery. 3 in 10 people and 1 in 5 people may have significant significant recovery. But combination of medication and therapies can control the symptoms. And again, I am telling you, there is no cure for schizophrenia, but we can control the symptoms with the help of proper medications and therapies. While coming to the medical management, mainly we are giving antipsychotic drugs to schizophrenic patient to reduce the symptoms, not to cure the disease. Antipsychotic drugs we are giving to reduce the symptoms. Mainly second generation antipsychotic drugs we are giving to the patient because second generation antipsychotics has less side effect comparing to first generation antipsychotics. Examples like clozapine, aripiprazole, acipnen, etc. So this kind of second generation antipsychotic drugs are mainly we are prescribing for schizophrenic patients, and the second generation antipsychotic drugs has less side effect, which is having less side effect comparing to first generation antipsychotics. But in some cases, if the schizophrenia is very severe and long lasting one and like a very old schizophrenia, we have found out or diagnosed in the very late stage means in that case we will give first generation antipsychotics like chlorpromazine, fluopenazine, haloperidol, etc. But this first generation antipsychotics is having more side effects comparing to second generation anti. Next thing is injectable long-acting antipsychotics. Injectable form of antipsychotics also will provide to the patient in some cases, like aripiprazole, fluopenazine, haloperidol, paliperidol, etc. Next, While coming to the therapies, mainly we are focusing on family therapy, individual therapy. Under individual therapy, individual psychotherapy and cognitive behavioral therapy. Already we had a discussion regarding individual psychotherapy and cognitive behavioral therapy in previous videos. I will give you the link in the description box. You can read and listen again that. So family therapy and individual therapies are playing a major role in the treatment of schizophrenia. One thing you just understand that for schizophrenia there is no cure, but we can control the symptoms with the help of this family therapy and individual therapy. Apart from that, we can provide social skill training to the patient, vocational support to the patient to make them to do some work, make them to active in the society. They can also work like a normal person if we give social skill training and vocational support. Then rehabilitation support, self-help group and coordinated community care. These all things will help the patient to live like a normal person. They can do their daily activities without the support of others. If we are planning and scheduling the training and providing the training in the proper way. But basically family therapy and individual therapy is playing a major role. Through the family therapy, family also involved in the treatment procedures, and they will also help the patient to lead the life in a normal way. Well, coming to the nursing management, the nurse need to assess schizophrenia. They need to establish a rapport with the patient. They need to establish trust with the patient and help in them in performing daily day-to-day activities. And other thing, assess the symptoms. Then, as a nurse, it's your responsibility to assess the symptoms, both positive symptoms and negative symptoms. Then, educate the client and educate the patient in a possible way. Then, provide psychological support and follow the doctor's order. While coming to the nursing diagnosis, impaired physical mobility related to depressive mood, impaired social interaction related to problems in speech or speech problems, risk of suicide related to marked changes in the behavior, or we can write risk of suicide related to depression. Then risk for injury related to hallucinations and delusions. Risk for imbalanced nutrition, less than body requirement related to refusal for self-care. So these are all some examples for nursing diagnosis. So far we had a discussion regarding what is schizophrenia, types of schizophrenia, symptoms of schizophrenia, and how we can manage schizophrenia. One thing you just understand that schizophrenia is a condition with no etiology. We don't know the exact cause, what's the cause behind etiology, but there are some risk factors and there is no cure for schizophrenia, but we can control the symptoms with the help of proper medications and proper individual and family therapy. Hope you understand. Thank you.